it go. Okay.
Got it.
Okay, I think we're good.
Good.
Thank you so much for joining me today. This is Dr. Carla Sullivan, who is the owner of Airway Health and Tongue Tie Center of Oklahoma. That's right, right?
Helpful. Yeah, great.
Long. I always am afraid I'm going to mess it up. Thank you so much for taking some time out of your busy day to do this little conversation with me. So let's just start off by tell me a little bit about you. I know you're a dentist, but like, how did you get into the airway space, oral restrictions? Like, tell me a little bit about that kind of
Sure.
journey.
So, I mean, it has been kind of a journey. So, I've been practicing general dentistry for about 15 years. And the pieces that I really like about general dentistry, I like prevention. So, like preventing disease and restoring. So, education is really important to me. So, this all kind of started, I'd say, like 10 years ago when I had my first baby who was very tongue-tied and had trouble breastfeeding. And around that time, I started learning about some connections with sleep. So I introduced sleep dentistry basically into our dental practice, and treated a lot of adults. And what I found is that it was really tricky to treat adults because we didn't really have growth on our side. So my treatment options were limited, and I felt like I was having to prescribe a lot of, I don't know, band-aids maybe. And so I through learning with my own kiddos some of the struggles they had been through, my practice started going from treating adults and then kids and then all the way down to infants. So um, I think really just seeing firsthand how important it is to have good oral function, and how much it affects the dentition and affected my own life and me personally, really just sparked my interest, and it's been fun ever since. So I'm always learning though. This field is changing so quickly. I mean, I'm sure
Yeah,
you feel that way too.
yeah,
And then I think the other piece is that um, the ties and just oral function in general, it's such a comprehensive field and it requires so much collaboration. And I feel like going from it's not just focused on the mouth, but the whole body is really it's appealing to me. And I love the problem solving, I guess, aspect of it.
yeah.
So
I
yeah.
understand that.
And our
We
kids,
do a lot of
I do
problem
think,
solving on our
right?
end, so
Being
it's
a
definitely.
mom too, I mean, a mom and a provider, I mean, it's almost like I feel like we're given these children, that need our support. And
Yeah.
it's definitely been eye-opening, and I think made me more empathetic for sure, because we've struggled with it all, and once
Yeah.
you've been on that side, it makes I don't know, it makes being a provider, I guess, even more rewarding too.
Yeah, yeah, for sure. So when did you start Airway Health? When did that kind of
Gosh,
fully
we used
come
to
about?
perform like all the procedures within our general dentistry practice, and then 2 years ago, we didn't. We did. We split the practices. So our Airway Health and Tongue Tie Center, it's a little more of a specialized practice, and it allowed us just to be more focused on specific care and add new treatment modalities. So even though we've been doing the procedures for a long time, we officially kind of established the practice 2 years ago. And man, it feels like yesterday. It really does.
Yeah.
Um, and I think Tulsa too, I will say, has been really fun to have the Airway Health and Tongue Tie Center here, because even when I was going through this, as a mom, we were having to travel out of state or really
Oh,
far
wow.
to get care. And so I wanted something here that we could support our Tulsa community. And so
Yeah.
it was really important to me that we establish it
Yeah.
early on.
So before we dive into kind of more info about oral ties and stuff, I was talking with a couple of different people, and I'm just curious your rebuttal here. That we're a little bit critical of dentists stepping into that space of oral restrictions and oral motor function, that they felt like you should kind of just stick to dentistry and teeth, and like that's sort of your bread and butter, and that maybe people more like speech therapists, ENTs, and some other people in that realm should be more responsible for the oral ties and restrictions and stuff. What's your take kind of on that, of like where dentists fall in that spectrum of care?
That's a great question. I think anytime I don't really like the scarcity kind of mentality. I think these like oral health affects us on a whole different level. And I think it's unfortunate that we always separate the mouth from the body. But
Mhm.
if you think about it, the mouth is the beginning of the digestive system. And yes, there are a lot of like neuromuscular um, associations, like think about our speech and chewing and even in dental school, like we really learned about the taste buds. We didn't learn a lot about oral function, but I do think as dental professionals, we know the anatomy really well. And I think we're in a unique position because we're screening patients who are healthy and who are not healthy. And a lot of times when we're screening patients, they're in a reclined position, which is more of a sleep position. So I think that we are kind of unique in that we are our care already is focused on prevention, right? So we can
Mhm.
identify red flags so early. Um, why would we wait until the disease is progressive? You know what I mean?
Yeah.
I know there's also a lot of discussion about like the financial incentives for dentists, but if you're on the outside, maybe you see something like that, but from an inside point of view, this is everybody I know in this field is driven by results and usually has a personal connection, right? Like if I if I could have fed my son or breastfed, I think that he would not have had so many surgeries. I think we would have had a better bond. And I don't know, I think that we should give more credit to the dental profession in general because I want that for our community. And I think
Yeah.
that things like nursing from an early age, I don't know that we appreciate how many connections there really are with dentistry, with early caries, with jaw formation, with um, uh,
Mm.
just like general connection. I think all of those things go hand in hand. So, and honestly, dentists too are like, we're really uniquely like we work in the mouth all the time. You know what I mean? Like we work with soft tissue, we work with hard tissue, we have a lot of training and behavior management. So, um, while I don't think it falls all under dentistry, like I definitely support a collaborative approach.
Yeah.
Why not? Why
Yeah.
not? That's my wheelhouse. That's our specialty. That's our area we work in.
Well,
So
and I love that you guys, and you especially, like you're driven by that collaborative approach, like that you are looking at like, yeah, like here's what I can do, but I know that this is what I can do. And if I need something over here, then let's bring in that person to help with this case and do that. And I just really love that you guys look for that and look for those opportunities to work with people outside of your specialty as well to fully address kind of what's going on with someone.
yeah. And I will tell you too, like recently I completed, I guess a couple of years ago, but my myofunctional therapy training, which kind of has some overlap with SLP. And then recently earned the IBCLC designation too. But for me, learning those things is not to help step into someone else's space. I feel like it helps me do a better job with diagnosing and treating when you
Mm.
can understand the big picture. So I really like this subject, and the more I can learn, the better. So,
Yeah.
and I think
Yeah.
we're all kind of like that a little bit, you know?
Yeah. I think
Um,
that's what makes the best practitioners are the people who are willing to learn, they want to collaborate, and they're just like, okay, how can we get this information and synthesize it into what I'm doing that is within my lane? And I think it gives a better picture, a better health approach to for anybody. But
Sure, sure,
yeah.
sure, sure. Honestly, to kind of back to your question, because I could talk about this all day, but um, whomever would be asking that type of question, for me, I would rather focus my effort on what we can do to work together versus deciding like which providers care it falls under. You know what I mean?
Yeah.
So
Yeah. I get that.
it used to get me frustrated. Now I'm kind of like, it's okay. You can think however, but let's just focus on the problem and get there.
So with that, like what are you looking for when someone comes in to Airway Health? They're like, hey, I've got concerns about an oral restriction. Like, what are you looking at? How do you know when there really is an oral restriction versus maybe just some tightness somewhere? Like, what are you kind of looking for assessing?
I think the biggest so there are some measurements that we take. And there's some, I guess, categories or classifications as far as like what a frenum and oral restriction looks like and feels like. But a lot of it is symptom based as well, and I find that typically oral ties will either fall under speech or chewing and swallowing or sleep. So I think about the three S's, it's like speech, swallow, sleep. And especially when we are evaluating kids, I would say from 5 to 12, um, I think it's really eye-opening because a lot of parents don't realize what is common may not be normal. Like we know people snore or grind their teeth or maybe are messy chewers or picky eaters. But I don't think we've done the best job of educating and how that could be a red flag. Things like
Mhm.
being anxious or I don't know, thumb sucking or that type of thing. I think, or even just overall general like body tightness, fight or flight. I think all of those things together. But when we're looking for ties, we're taking photos. There's a lot of like a feel to it as far as range of motion and tone to the tongue,
Mhm.
and just being able to like move the tongue independently from the jaw. But then you have the symptoms to support it. So um, it's not always how it looks; it's how the tongue can actually function that goes into our overall diagnosis. So and typically well, always there's always a function component to our treatment plan, right? Like it's not always just a surgical approach or a treatment. It's a treatment followed by supportive care.
Mhm.
Um, so I think those things are all really important. And the diagnosis does vary from an infant that's having a feeding problem to an adult that has mild, moderate, severe sleep apnea,
Yeah.
and how we can compensate over time too.
Yeah. So what are some signs or symptoms, speaking of the education piece, that parents should be on the lookout for of like, hey, these are, let's say, even like major red flags, like, hey, here's your major red flags that there might be something going on that needs to get addressed.
Yeah, I would say really common things would be bedwetting, snoring, um, having like dark circles kind of under the eyes, or what would seem like attention issues, almost like ADHD type symptoms, oral rest postures, just resting with the lips apart or mouth breathing. Um, I may have mentioned this, but like poor posture or waking up with bedhead, moving all over the sheets. Um, because really, I think a lot of times we see sleep as our main symptom from an oral restriction, oral ties. So that's usually what I look for. Also, though, things like thumb sucking, finger sucking, biting on the shirt, biting fingernails, um, being a messy or picky eater, or not eating very quickly, those types of things, I think are things you should just keep an eye on. Um, Funny enough, and I'm a mom too, right? So I'm guilty of this, but a lot of times when I ask a parent, like, so how does your child sleep? Either we don't know, or if the kid's not waking you up, you're like, sleep's great. That's
Great.
my great sleeper. But the quality of the sleep or the duration of the sleep may not be ideal. But as long as you don't hear those footsteps waking you up, we stop monitoring after a certain age. So um, I think it's always a really good idea to keep an eye on, is the mouth open at sleep time? Are we drooling? Does your kid wake up refreshed and rested? Does it take them a long time to fall asleep? And right now, one of our things we're working on is actually trying to reach out to schools and educate teachers because they actually see a lot of our little kids napping. You know what I mean? During the day or thumb sucking type habits.
Mm-hmm.
And so I think they could really be a great resource for us, just like we do vision screenings at school or hearing screenings, to have that kind of evaluation or eyes too.
Yeah, yeah, that's really cool. What besides sleep, like what other impacts on kids do these oral restrictions kind of have?
So I really um, the tongue is a muscle that is the driver of all oral growth, right? So the tongue is supposed to rest in the roof of the mouth And the pressure on the roof of the mouth is what makes our jaws grow out and wide. So that establishes our airway. But if we grow these big jaws and we have space for our teeth and we have good range of motion of our tongue, it helps us to chew and swallow our food without a lot of extra effort. It helps us with speech sounds. So if you think about like your R's and your L's, it's really important to be able to elevate the tongue. And then there's also some really interesting data about how our bodies relax and regulate. And so even that tongue up posture can help ground us and support our nervous system to be able to transition from that fight or flight to rest and digest. So I'm sure you're reading this too, but my big thing is like sleep and sugar. I mean, I sleep and sugar, sleep and sugar. We know how valuable the gut and the microbiome there is. And so like the tongue is the first step in chewing our food, being able to form a bolus so that then we can go to the gut and get that healthy digestion process, secrete serotonin that gives that good feedback to our brain. So I think it's just so much good oral function is so valuable for all of our other systems to work, right? It's how we get oxygen into our body.
Mhm.
It's how we get nutrition and feed ourselves. And then obviously sleep's probably more important than either of those,
Yeah.
Um, but it's not just about teeth, it's not just about teeth, but if you want to know about the dental kind of a side effects, if you think about your tongue, it's how you clean food from your teeth. And so when your tongue is up, it automatically turns your nose on. So things like mouth breathing can contribute to cavities, decay, periodontal disease. And I think that also, is a problem as well. So man, it's important. It's really important. Ugh.
What is the best way for parents to advocate for their kids if they feel like their kid might have an oral restriction, but maybe the doctor or their dentist that they're seeing now or whatever is kind of like, meh, like kind of iffy about it?
Yeah. I cannot stress enough that you just advocate for your kid, and if you hear no and you really think something's going on, just don't be afraid. You just have to find the right person that will listen and get into the right network.
Mhm.
I will say I've been on that end of things, and as a provider, it's really intimidating and stressful when I've had to go back with my own son to an ENT 6 times and say it's not working, it's not working. I've been told some kids just mouth breathe. It just might be the way he is. And everything I've read, it's like there's got to be something else. So, um, we talk a lot about why are these ties being diagnosed all the time? The dentist wants to make money and they're fine. And it's like I attribute a lot of it to moms and advocacy, like we always say advocate like a mother because you do, like
Yeah.
something is
Yeah.
going on. And quite frankly, I used to get really frustrated, but just like in dentistry, like we don't have education. Like nobody taught us about oral ties in school. The pediatricians don't learn about oral
Mhm.
ties or restriction in school. ENTs may learn a little bit about like how to treat things, but not the function piece of it. And I've even heard from a lot of our SLP colleagues, I mean, even PTOT, there hasn't been a lot of discussion there, even though it can affect, our profession.
Everything.
So and the things that we're seeing on a regular basis. So I, like just take a deep breath, do your research, and providers, they want the best too. So sometimes a conservative approach is better. I'd rather a provider say, hey, I don't understand, I don't know, rather than just kind of
Yeah.
ignore your concern. You know what I mean? But
Yeah.
if you don't get the answer you want and you think something's wrong, keep going. Keep going.
So
Uh,
how prevalent are like true oral restrictions really? Because it seems like I see more and more information about it. And so it's like, man, are they really like everybody has one, or is it, we just think everybody does because there is a little bit more education out there now. I'm seeing more on social media and different things about it, but maybe you've looked, I don't know, what's like the actual prevalence of oral restrictions?
was like 2 years ago, the JADA, the Journal from the American Dental Association, I want to say their report was something like 1 in 50, it was something really big. But we see it almost as common as 1 in 4. Um,
Mhm.
the hard part to, I think, really assessing that is we're not looking for it, right? So we only are looking at babies or adults who are symptomatic. We're not looking in every single kiddo's mouth necessarily, like
Mhm.
when you're born. So I don't think we really truly know the stats. You know,
Yeah.
and my practice is a little bit unfair too because I see a lot, but people are coming to me because they have a
Yeah.
concern,
Yeah.
right? So
Yeah.
it's kind of screening for us. But I do think it would be really valuable if we had more screenings. And I think as breastfeeding continues to be a popular choice, I think we'll see more screening and early resources, and we'll have a better idea of what that number really looks like.
Mhm. How do you decide if a kid needs um, a release and more of like the therapy side of things or the what is it, the myofunctional stuff,
Yeah, yeah.
versus like just some exercises and like work or like how are you kind of making that determination?
Typically, in a typical range of motion, you should be able to open your mouth to full maximum opening, and your tongue should be able to at least reach the top of the mouth. So, a lot of times I see, especially in kids under 8, that they tend to just have more of a lower tone, or they've found ways to compensate. So, I always like to give those cases just a chance to see what kind of range of motion you can get by just kind of stimulating the tongue itself and getting more oral tone. Um, but as an adult, sometimes, I mean, you typically always have a function piece that goes with it, right?
Yeah.
But you can just see more of the effects over time. Because with an adult, you have no more growth. So you have that fixed point. With a kid, you have to sort of estimate what the potential growth will look like. And so you want to be careful about when you time a procedure
Yeah.
for a kid. So if when in doubt, we just don't treat, we start with therapy and then we evaluate as time goes on. Um, what we'll find is that if a child is restricted, then typically they'll do well with their exercises, but they just won't be able to kind of like meet that last goal or hold things for a particular period of time, or maybe they can get the range of motion, but it's effortful, and we want it to be, a
Mhm.
very easy movement about the mouth. So,
Gotcha.
um, and that's why we do recommend oral motor assessments, and working with an oral, like a myofunctional therapist or an SLP to determine what that looks like for
Mhm.
each person.
I love that you don't just go like straight for the release and you're like, all right, we're just releasing everybody and
Yeah. Ooh, you don't heal well is the thing. So it doesn't make it any better for me. Like I want my patients to do really well. I want people to hear more of the good than the bad of the tongue tie world.
yeah. Do you feel like, or have you seen in anything you've read or whatever, that there are correlations between oral restrictions and constipation? Like maybe some tension all the way through the body that causes that, or maybe there's not an association. I don't know.
Yeah, I've seen some interesting papers connecting constipation, pelvic floor issues in general. I'm not sure, and I don't know if anyone is sure if that has to do with the deep line, of fascia that runs like
Sure.
through the midline or the gut, or if that has more to do with not being able to like masticate our food and
I
add
think that,
saliva to be able to
yeah.
process that well. Um, or if it could even have to do with just that fight or flight response, like if you're
Mhm.
always in fight or flight and it's hard for you to get to rest and digest, then a lot of times that GI system, can get backed up. Um, so I think now that so many of us are asking so many questions and we're looking at it from all these different viewpoints, I think we'll see more and more data come about. But I think there's a lot more to learn. I
Yeah.
think we're seeing these observations, but we don't really know cause and effect in the literature, at least. So,
Sure. Right. Any other tidbits you want to add about oral
oh.
restrictions? Or I know you could talk about this all day long, but
I love it. You know, I love it. Um, oh, I don't even know. I think for me, the biggest takeaway is um, doing do your research. And if you have questions, ask them. I would love to see from our community standpoint, I would love to see more advocacy for breastfeeding and for supporting early development. You know what I mean? From a full whole body capacity, right? So like I think if we intervene a lot earlier, we wouldn't have so many problems down the road and maybe treating people before they get sick. And so, from a Thai kind of standpoint, I just think keeping an open mind and continuing to learn is what's going to really, really drive us forward as professionals, but also going to give us a chance to help as many people as we, possibly can too.
yeah.
Yeah.
Last question, super
Yeah.
easy. Where can people find more information about Airway Health and Tongue Tie Center or oral restrictions? Anything about you?
Oh, that's so sweet. So we have a website. Our website is tonguetieok.com. And then we have, an Instagram page, and Dr. Carla Sullivan. I have my Instagram that I try to share tidbits, but I also really love colleagues at the Breathe Institute. I think that's a great place to get good information. I like the ASAP pathways and a lot of the tongue tie, the professional associations, I think, put out some really good information. So that's who I would be following in general to see. I love Dr. Audrey Yoon. She's a great follow for anyone kind of thinking about orthodontics and how ties relate to that. There's some really smart people in the field that have some really great data that's going to be coming out. Dr. Baxter's a good follow too in Alabama. He has the tongue tie center there. So, um, yeah, those are my favorites. Those are my favorites.
Okay. All right. Sounds good. I'll have to check out a few of those myself. So,
So sweet, so
all
sweet.
right. Okay. Thank you so much. I'm going to stop the recording here.